My name is Sanket Chauhan. We are building platform robotics for endoluminal procedures. And by endoluminal procedures, I mean that anywhere where we take a flexible scope and with a camera attached at the tip of it and do procedures or therapeutic or, bronchoscopies, colonoscopies, ureteroscopies, and so forth. Now, when you have a platform technology that is capable of doing a lot of those things, you have to start somewhere. And how do we decide where to start somewhere? Well, there's some clear markers of that. Market size is probably one of the most simplest ones. And when you do the analysis of the number of colonoscopies these perform, and that's a clear winner right there, as compared to the number of ureteroscopies that are performed, for example. So now the interesting part about ours is that this is automated colonoscopy, under where the gastroenterologist is not himself or herself doing the procedure, but they are more a supervisor. So think of like the Tesla's, full self-driving. And this is essentially, we call that smallest Tesla in the world, which has a 15 millimeter diameter. So the platform technology, we mean that, you can see the diameter and the length of a colonoscope or a bronchoscope can be different than upper GI or a lower GI. This is an animation we had pretty early on. In this case, the robot is inserted, the scope is inserted in the mouth, it automatically advances, starts scanning. If it finds something, it flags it. In this case, it finds an ulcer, recommends a biopsy. Forceps are attached next to the robot. It advances on its own. It gives a trajectory of where it's going to go. And once the physician okays it, it's going to go and take that bite. Then this is an example of colonoscopy. Again, it's going to look for normal anatomical landmarks. If it finds something, it's going to flag it. In this case, finds a polyp, recommends a polypectomy. Snare is attached next to the robot, advances on its own. It's going to give a trajectory of where it's going to go. And once the physician is it, it's going to go and, take that bite. Now, granted, this is an oversimplified version of this animation, but this is kind of what we have been working on. And the technology, the way this works is exactly how we are trained as physicians. And the way we are trained is that, there are two specific things in a surgical procedure that we do. Number one is identify the surgical anatomy, right? That we know, okay, where to go, where not to go. This is where we can find this particular nerve or this particular vessel. You have to stay safer. And the way we know that, because throughout our years of training with medical school, residency, fellowship, doing the procedures and attending, we know the anatomy. And we know because we have seen pictures of that. We have trained our mind by seeing hundreds and thousands of those images, whether it's the atlases, whether it's the pictures, whether it's the procedure. So we know that. That is what the AI is doing in our robot, right? That one step is done by AI of identifying the surgical anatomy. And then the second part as physicians, what we do is that we process that information in our brain, and then that goes to our hands where we are doing the psychomotor skills, whether it is torque or insertion or retraction. And we have a closed loop system between our hands and our mind, which by experience, we realize that, oh, wait, we need to pull back, not push in. And this is kind of where the robotics comes into play. And there is a closed loop communication between the robotic parts and the AI parts. It's completely AI driven. So going back to this, I'll show some of the early prototypes that, we have developed. This is obviously product development is a long process, especially in medtech. So this is an example of where this is a single click colonoscopy. As you can see, this is the video from the tip of the camera. And as you can see, this is identifying the lumen, where to go and where not to go, which is the walls. And now this is a completely automated. There's nobody who is actually maneuvering this robot, this one single click, and it's completely, the hardware and the software, it's all kind of, proprietary. This is another video of that, the same thing, and you can see the transillumination over here, which is basically the direction in which the scope is moving. And you can see the closer it gets to the wall, it kind of goes away. It stays away from the wall, and it finds the path, and it kind of moves forward. So these are some of the videos we have. Where we are right now is that we are getting into animals very shortly, and we'll have a lot more videos to share at that point.